Posterior cruciate ligament (PCL) injury is a less common, but significant knee injury that can affect mobility, stability, and overall joint function. The PCL is one of the 4 major ligaments in the knee, located at the back of the joint. It connects the femur thigh bone to the tibia, shin bone, and plays a crucial role in preventing the tibia from moving too far backward relative to the femur, unlike the anterior cruciate ligament ACL, which is more commonly injured due to twisting or pivoting motions. PCL injuries typically occur from direct trauma or excessive force applied to the knee in a flexed position. Although PCL injuries are less frequent than ACL injuries, they can still lead to significant knee dysfunction and long-term complications if not managed properly. The most common mechanism of PCL injury involves a direct impact to the front of the tibia while the knee is bent. This can happen in motor vehicle accidents, where the shin forcefully strikes the dashboard in what is commonly known as a dashboard injury. This type of trauma pushes the tibia backward, stretching or tearing the PCL. Another common cause is sports-related injuries, especially in contact sports like football, rugby, and soccer. Falling on a bent knee with the foot pointed downward can generate enough force to damage the PCL. Hyperextension injuries, where the knee is forced beyond its normal range of motion, can also contribute to PCL tears, often in combination with damage to other knee structures such as the ACL or meniscus. PCL injuries are classified into 3 grades based on the severity of the damage. A Grade 1 injury involves mild stretching of the ligament without significant tearing, leading to minor instability and discomfort. A Grade 2 injury is a partial tear of the PCL, causing moderate instability and increased difficulty in performing activities that require knee stability. A Grade 3 injury is a complete rupture of the ligament, resulting in severe instability and potential damage to surrounding structures. In some cases, PCL injuries occur in combination with other ligamentous injuries, leading to what is known as a multiligament knee injury. These complex injuries often require surgical intervention and prolonged rehabilitation. Symptoms of a PCL injury can vary depending on the severity of the tear. Unlike ACL injuries, which often present with an audible pop and immediate swelling, PCL injuries may not always cause immediate symptoms. Many individuals experience mild to moderate knee pain that worsens over time,
along with swelling that develops within a few hours after the injury.
The knee may feel unstable, particularly when walking downhill or descending stairs. Some individuals report a feeling of the knee
giving way during certain movements.
In severe cases, a noticeable backward sag of the tibia may be observed when comparing both knees. Chronic PCL insufficiency, if left untreated, can lead to long-term knee instability, increased stress on the surrounding structures,
and an elevated risk of osteoarthritis.
Diagnosis of a PCL injury involves a thorough clinical evaluation, including a medical history, physical examination, and imaging studies. During the physical examination, specific tests are performed to assess PCL integrity. The posterior drawer test is one of the most commonly used tests, where the examiner applies posterior force to the tibia while the knee is bent at 90 degrees. Excessive backward movement of the tibia suggests a PCL injury. The quadriceps active test and the posterior sag sign test are additional clinical maneuvers that help identify PCL damage. Imaging studies are crucial for confirming the diagnosis. X-rays can help rule out fractures and may reveal a posteriorly displaced tibia in severe cases. Magnetic resonance imaging (MRI) is the gold standard for assessing PCL injuries, providing detailed visualization of the ligament, cartilage, and other soft tissue structures. Treatment of PCL injuries depends on the severity of the tear, the patient's activity level, and the presence of additional knee injuries. Many isolated PCL injuries, especially grade 1 and grade 2, tears, can be managed non-surgically. Conservative treatment focuses on reducing pain, improving stability, and restoring function. The RICE protocol rest, ice compression, and elevation is commonly recommended in the initial phase to minimize swelling and discomfort. Nonsteroidal anti-inflammatory drugs and NSAIDs, such as ibuprofen or naproxen, help alleviate pain and inflammation. Physical therapy is a cornerstone of non-surgical management, emphasizing strengthening exercises for the quadriceps and hamstrings to compensate for ligamentous instability. Balance and proprioception training are also incorporated to enhance neuromuscular control and prevent recurrent injuries. Bracing may be used in some cases to provide additional support and limit excessive posterior tibial translation during activity. Surgical treatment is typically reserved for severe PCL injuries, including complete tears. Grade 3 multiligament injuries or cases where conservative management fails to restore knee stability. PCL reconstruction is the most common surgical approach, as primary repair of the ligament is generally not successful due to poor healing potential. The procedure involves replacing the damaged PCL with a graft, which can be an autograft harvested from the patient's own tissue or an allograft donor tissue. Common autograft options include the patellar tendon, hamstring tendon, or quadriceps tendon. The surgery is usually performed arthroscopically, with small incisions used to insert a camera and surgical instruments. Tunnels are drilled into the femur and tibia to secure the graft, which then serves as a new ligament. Postoperative rehabilitation is essential for optimal recovery and includes gradual weight-bearing, range of motion exercises, and progressive strengthening. Recovery after PCL injury varies, depending on the severity of the tear and the treatment approach. For individuals undergoing conservative management, recovery may take several weeks to a few months, with a focus on regaining strength and stability before returning to full activity. For those who undergo surgical reconstruction, the rehabilitation timeline is longer, typically ranging from 6 months to a year. The initial postoperative phase involves reducing swelling, preventing stiffness, and protecting the graft. As healing progresses, physical therapy focuses on restoring muscle strength, improving joint mechanics, and preparing for return to sports or high-demand activities. Long-term outcomes of PCL injuries depend on several factors, including the effectiveness of treatment, adherence to rehabilitation, and the presence of associated injuries. Many individuals recover well with proper management, but some may develop residual instability or post-traumatic osteoarthritis over time. Chronic PCL deficiency can lead to abnormal knee mechanics, increasing stress on the patellofemoral joint and leading to degenerative changes. Preventive measures, such as maintaining strong and balanced lower extremity muscles, avoiding high-impact activities that strain the knee, and using proper techniques in sports, can help reduce the risk of further knee problems. Advancements in research and technology continue to improve the understanding and management of PCL injuries. Emerging treatments, including biologic therapies such as platelet-rich plasma, PRP injections, and stem cell therapy, are being explored for their potential to enhance ligament healing and reduce recovery time. Additionally, improved surgical techniques, such as double bundle PCL reconstruction, aim to restore knee biomechanics more effectively and improve long-term stability. PCL injury is a significant knee condition that can impact function and quality of life if not properly diagnosed and treated. While many isolated PCL injuries can be managed conservatively, surgical reconstruction is often necessary for severe tears or cases involving multiple ligament injuries. Rehabilitation plays a crucial role in recovery, emphasizing strength, stability, and neuromuscular control to prevent future complications. Understanding the mechanisms of injury, treatment options, and long-term consideration allows individuals to make informed decisions regarding their knee health and overall well-being. With continued advancements in medical research and surgical techniques, outcomes for PCL injuries are expected to improve, offering better functional recovery and long-term joint preservation.